Good morning, everyone, and welcome to Understanding Medicaid Waivers. This is another session from the BDI Empowers webinars. That's season 1, episode 5. Just a reminder, if there is a topic that interests you, feel free to share in the chat, and we'll make sure we prepare a presentation that answers all your questions. Before we start, let's go over some housekeeping items. First, please be sure to keep yourself muted the entire time so we can keep the sound quality clear. This webinar is being recorded and the recording will be supplied to all attendees. Also, please refrain from sharing personal information. This chat is accessible to all attendees and any personal details you share will be visible to everyone. But you are highly encouraged to share your questions in the chat, and our speaker today, Maki, will be happy to answer those after this presentation. If you look up to your screen, you'll see the chat icon. If you click there, you access the chat, and you'll see all the other. You can communicate with all the other participants and the speakers. In the Q&A sections, you can also share your questions. If you hit the raise your hand button, you'll have the opportunity to ask your questions in person after the session. Before we move on, here is a reminder for all the programs offered at BDI Empowers. We have behavioral health, family support services, benefits navigation, work incentive planning and assistance, jobs and career services, and Georgia Community Trust. And before any further ado, let me introduce you to our speaker today, Anna Maki, Director of Program Services here at BDI. Good morning, Anna.
Good morning. Thank you so much for having me this morning. This is a very important topic, so I'm really grateful for the opportunity to share information with folks. So, as you know, I'm the Director of Program Services at BDI, and this particular session of understanding Medicaid waivers really comes out of our benefits navigation program, which we started back in 2016. So, a big piece of what we're doing in that program is helping people understand what benefits are available and how to advocate for those benefits. So, our session today is quite on point with that. So, what do we want to focus on today? Really, I want you to understand all the different Medicaid waiver programs that are out there. There's different types of waivers. I think we get very focused on Now Comp because that is the most robust program. It's the one that I really need everyone to be on that planning list for. But I think it's important to be aware of other waiver programs as well. So we're going to talk about other types of waivers. We're going to talk specifically about eligibility requirements for Now Comp. And we also want to go through what that application process looks like and help you understand, because it feels like a mystery. When you apply for Now Comp waiver, what is that process? What is the planning list? How do you get on the planning list? How do you get off the planning list? So these are things that we're going to focus on today. So when we talk about a waiver, what is it exactly that we're waiving? What we're waiving is having services in an institutional setting. So individuals that meet eligibility criteria for a Now Comp waiver are essentially individuals that are meeting eligibility criteria for a level 2 level of care. And what that means is if a physician says, yes, you meet level 2 care, that means that you're meeting that criteria to receive services in an institutional setting, like an intermediate facility for individuals with intellectual disabilities or developmental disabilities. Well, we don't really want our individuals in an institutional setting. We want them in a home and community setting. So a Medicaid waiver, what we're waiving is receiving those services in that institutional setting in favor of receiving those services in a home and community-based setting. That's what it's really all about. But in order to be eligible for that higher level of services, you have to meet that level of care, that level 2 level of care. So what types of waivers are there? So remember how I mentioned Now Comp? We really want to focus on Now Comp today because again, that is the highest level of services. But let's talk about some of these other waiver programs. So Georgia Pediatric Program, the service is in the title. It's a pediatric program. This is earmarked for individuals under the age of 18. And generally, these services are skilled nursing services. So let's say you have a medically fragile child who requires literally 24/7 care because the need of repositioning or because of the need to change catheters or what have you, you would need extra supports to do that. The best moms, we're all mama bears here, but it's not viable to provide 24/7 care. We have to sleep. So when we have individuals that require that level of 24-hour care, again, we don't want to receive those services in an institutional setting. We want to receive those services in a home setting. So the Georgia Pediatric Program provides to allow those services in the home. Generally, individuals are going to age out of the Georgia Pediatric Program into CCSP, the Community Care Service Program. So while there are some individuals in CCSP that are being served, like in residential placements and things like that, that aren't medically fragile, the majority of individuals are requiring that skilled nursing. So here's the thing is you can be on the planning list for now comp, which is that higher level of program while you're receiving services from any of these lesser waiver programs. Okay. So it's just important. It's not necessarily an all or nothing thing. So looking at the elderly and disabled waiver, the program that is most commonly affiliated with this is called Source. And what this program is this is in-home care. This is a lot like in-home health supports. Having somebody come in to help perform activities of daily living, making sure that we have a meal prepared, making sure that the person's hygiene is okay, helping bathe that person if necessary. So there are no community access services affiliated with an elderly and disabled waiver. These are all in-home services. The independent care waiver program. Independent care waiver program is generally earmarked for individuals who have traumatic brain injuries, as well as individuals who are experiencing challenges because they're non-ambulatory, but their cognitive function is fine. So, what do we do in those situations? Again, we want to make sure that those individuals have community living supports because we don't want to have care in an institutional setting. We want care in the home. So, what that would look like if you have an independent care waiver is perhaps having like community living supports, or what they might call having a personal assistant to help transfer from the bed to the chair, helping get dressed, helping shower, all of those things that are tied to those activities of daily living that the individual might struggle with otherwise. And then we come to now comp. So again, you can receive services under another program while you're on the planning list for now comp. Once you have a now comp waiver, at that point, you're not eligible for these other programs. So just wanted to make that clear. So now comp, I think we have another slide that's focusing more on now comp. Let's go to that one. There we go. So what is the now comp waiver? So think about services through the Department of Health. So a lot of times people think about all these different types of services that are out there. How do they know what to go for? You're really looking at it by agency. So what do we need from the Department of Health? We need services that are going to help us live independently in the community. So those services begin Department of Health down to the Department of Behavioral Health and Developmental Disabilities. This is the state agency that is governing all of these waiver programs. And so they're the group that is handling the funding. They're the group that's managing the different policies as it relates to these waiver programs. So it's managed through the DBHDD. Right now, we have more than 7,000 individuals on the planning list. And historically, Georgia has been sort of on the lower end of the 50 states as it relates to providing services for individuals with developmental disabilities. It tends to be a battle every year to have the state legislature, put money in the state budget for these services. Um, just to give you a little bit of a historical reference, the Olmstead decision, this is through the Supreme Court decision that basically made it the law of the land that individuals with disabilities can receive services in a home and community-based setting. That decision came out of a lawsuit in the state of Georgia, whereby Georgia was defending its right to institutionalize. So that's sort of our state history as it relates to now comp waiver. And while we're still a little bit behind the 8 ball in providing that higher level of services to individuals with disabilities. So right now there's 7,000 people on the planning list. What does that mean? It means that, first of all, you need to be on the planning list. And secondly, you need to make sure that you're aware of what those planning considerations are so that you can do an effective job advocating, because awards are based on who is most in need. So we need to understand, what does most in need look like? What does that mean? And how do you show that your individual is meeting that criteria? So what are the program goals behind Now Comp Waiver? Again, we're waiving services in an institutional setting. So we want individuals to be able to live as independently as possible in the least restrictive setting, which means in their own home, right? Or in an alternative home of their choosing, such as a group home setting or a host home setting that's going to provide the right level of supports for them. So now comp is intended to promote and facilitate inclusion in the community and ensure safety in that home environment. In other words, that everybody is getting their needs met. So what's the eligibility criteria for a now comp waiver? So when we're thinking of now comp, we're looking at individuals who have an intellectual disability or a developmental disability, understanding that this is a chronic condition, meaning this is not temporary, it's going to be lasting over the individual's lifetime. And the onset of this condition must be prior to age 22. What they're looking at is the severity and impact of that condition, such that there is some cognitive impact, or adaptive function impact, meaning impairment in the individual's ability to perform day-to-day activities of daily living. So we have some conditions that may not necessarily have an intellectual disability as part of it, but it's a developmental disability that is construed as a condition closely related to a intellectual disability. And so when you see conditions like cerebral palsy or autism, these are both spectrum type disorders, meaning that you'll have individuals with some severity and others with more severity. So the DBHDD is looking carefully at the documentation of those disabilities to determine if they meet eligibility criteria. And the basis for that is going to be those quantitative scores in their psychological evaluation. So what does that look like? That means they're looking at that psychological evaluation to look for cognitive function, what's that full scale IQ, and looking at adaptive function. And so adaptive function, again, is that a person's ability to perform day-to-day activities. So there's different domains that comprise adaptive function. Somebody's activities of daily living, somebody's social skills, things like that. So what they're looking at, again, is a quantitative score. They're going to evaluate that psychological evaluation. They're going to first look at the full scale IQ. If that IQ is below 70 and the individual has an intellectual disability or a closely related condition that has some cognitive impact, well, then that's going to suffice. What if the individual's IQ is above that cutoff score? So what if you have, for example, autism without accompanying impairment? Is that individual going to be eligible for a now comp? Well, that's when it's all going to boil down to, what's that adaptive function score? If that adaptive function score is above 70, then even though they have a condition like autism, if their IQ is above 70 and their adaptive function is above 70, they're not going to be eligible for now comp. Their adaptive function score would need to be below that cutoff score of 70, showing that the severity and impact of the condition is compromising their ability to perform some basic day-to-day activities. So just to give some illustration, you could have a condition like Down syndrome with a IQ score of 68. That individual is clearly going to be eligible because of the level of cognitive function there. You could have an individual with autism with an IQ above 70, but a global adaptive composite below 70, and that individual is going to be eligible. So if you have any confusion about that process and you haven't applied for um, the waiver yet, I would strongly encourage you to, let us take a look at that. Let's do a pre-evaluation, like a pre-screen, to make sure that you're eligible. Because if you're denied now comp eligibility, it's kind of hard to get them to overturn that decision. I would much rather get a situation where we are supporting individuals with that initial application for now comp, ensuring that they have the appropriate medical documentation to support those eligibility requirements. What kind of services can you get through now comp? It's going to begin with support coordination and fiscal management. So let's say you get awarded a waiver. Yay, I've been awarded a waiver. The first thing that's going to happen is you're going to have to get your physician to sign off on a DMA-6, which is going to attest that they meet that level of care. And then you're going to have to select a support coordinating agency and a fiscal agent. So those services and coordination are embedded in the individual's individual support plan for a waiver. Then the other services are going to be needs-based. What does the individual need? Does the individual need a program during the day to help promote adaptive and functional living skills and to provide an outlet for social skills? Okay, if that individual needs a day habilitative program, then that's going to come under the community access group service. What if the individual needs support in the community, but they don't want to be part of a group? Well, then you would look at community access individual as a service opportunity. So that would be having a provider that's taking the individual out into the community, maybe to participate in, some event in the community, or maybe simply requiring companion assistance to go shopping or companion assistance to go to the gym. That would be, if it's one-on-one, that's community access individual. If it's two or more people, that's going to be community access group. What's pre-vocational support? So pre-vocational support under a waiver is services that are delivered through a provider, usually through one of these rehabilitative programs that's offering pre-vocational support. It's usually a 1-year service because the intention behind pre-vocational support is to get to supported employment. So pre-vocational support looks and acts a lot like job readiness training. But this is a service under the DBHDD versus a service under vocational rehab. Other services under a waiver, a big one is community living supports. So community living supports is generally construed as services in the individual's own home. So if the individual is living at home with the family, that's having a provider coming out and providing some support in the home. If the individual is in a group home setting or in a host home setting, these are services that cannot be self-directed. These are services that you have to go to an agency for, and these are services that community residential alternative is a service that is limited to the comp waiver. What is respite? Respite is a service meaning that you can bill up to a 24-hour cycle. So respite is usually done in terms of units, like 30 units is the maximum amount of respite under a comp waiver. So that would be 30 times in which a person can bill up to 24 hours in that period. The respite unit is like a flat rate unit. So it's going to be, I think it's $156. So if you were using one respite unit, whether you were using it for 1 hour or 24 hours, it's going to be the same amount to the provider. So it's going to be important for you to kind of think through your budget and think through how you're managing your care using these respite units. Behavioral support is also a service that is provided under both NOW and COMP. There are some requirements with the provider being BCBA and making sure that they have those certification requirements and are a listed provider through the DBHDD. And then supported employment. So, really good question of how does a waiver interact and interface with GVRA? So when you think about any services related to work, generally you're starting with Georgia Vocational Rehabilitation Agency. So GVRA, think of it like this. GVRA is helping people get started. Okay. So they're helping find a provider, doing the job readiness, doing the supported employment, getting the job, maybe even customized employment where you're doing some job negotiating and carving out a job. But once you get to the point where that individual has been employed and they're stable on the job, and it's usually after 90 days, then at that point of what we're doing in supported employment is just job stabilization. It moves out of voc rehab into DBHDD. And so DBHDD really has two ways to fund supported employment for individuals who are on the planning list but haven't been awarded a waiver yet. They're going to provide supported employment under their competitive integrated employment program, right? So you have CIE for people who are on the planning list. If you have a waiver, then you're providing supported employment under waiver funding, and that would be on your waiver ISP. How do you get started? First of all, I hope all of y'all are on the planning list. If you're not on the planning list, this is a great opportunity to get information to make sure that you get on the planning list. And as a next step, again, if you're not on the planning list, let us know, send me an email so that we can send out a Now Comp application to you to get started with this process. If you are currently in intensive family support, you must be on the planning list. If you're in traditional family support, you may or may not be on the planning list. So how to get on the planning list? You got to apply. So the application process is actually pretty simple. It's simply a 2-page application. It's going to ask, what's the individual's name and contact information? What is your name and contact information? Does the individual have guardianship? Is the individual a minor? Or are they competent? Or have they been adjudicated incompetent and you have guardianship? It's a big issue with DBHDD. Even though that we get a lot of questions around that, even though you're the responsible party as the parent and you're taking care of your loved one and you're like, they're not able to make decisions for themselves unless you have gone through the process through the probate court to be adjudicated incompetent, they're going to legally be viewed as competent. So you would check that box on that application. And then the second page of the application is simply asking, hey, what services do you need? And I get a lot of anxiety from folks around that, like, oh, what should I put in this section? First of all, that's not driving the services that you would receive. So it's okay to answer that question in a broad way. We're requiring services that are going to help promote community inclusion and to live independently, something super broad. Or you can be specific, he's aged out, he needs a day program, we need some help at home, or we really need a lot of respite, or we're seeing an increase in behaviors and we need behavioral support. So, just put in that section whatever services are sort of top of mind, knowing that as you're going through the process, there's a lot of assessments, there's a lot of evaluation that's really going to hone in on what that individual's needs are. So that's really the application. It's 2 pages, pretty straightforward. The hard part with the application, I call it the scavenger hunt. There's all this information that you need to attach to your application. right? So there's a request for privacy practices form. It's like, where's that form? That's why, again, if you're not on the planning list, let us help you with that so I can send you the application and send you that privacy practices form. And then they're going to ask for psychological evaluation. Why? Because they are using that psychological evaluation to make sure that you're meeting that criteria. So before you submit that documentation, now that you know what the criteria is, make sure that you can see that clearly on the psychological evaluation. So here's what it looks like. You're first going to submit the application and supportive documentation to your regional office. One of the pages of the application lists all 6 regional offices. Um, Most of y'all, especially if you are currently receiving family support services through Bobby Dodd, you're in Region 3. So you would be forwarding documentation to the Region 3 intake coordinator. So they receive the application. They have their little checklist that they're going to go through to make sure that they've got all the documentation. Once they determine that, yes, this application is complete, we have everything that we need, they're going to schedule an intake evaluation. And so that's usually a social worker. Used to back in the day, they would come out to the house. Now they're doing that more like virtually, like having a session like this where they can lay eyes on the individual, but having a conversation about basically attesting and confirming that the individual meets this criteria, that they require some supports with activities of daily living. And then once they've confirmed that and they've determined that this person is indeed eligible, the DBHDD sends you a letter. It's that you've been predetermined eligible for services. However, funding's not available, so we're going to be placing you on your regional planning list. And so once you're placed on the planning list, at that point, you're assigned a planning list navigator. So that planning list navigator is charged with helping to assess and helping to identify those individuals who are most in need. Let's look at that process a little bit. So, what happens with that planning list navigator? So, the planning list navigators don't have a caseload per se. They have literally hundreds of people that are on the planning list. Their job is to try to sort through that and figure out who's most in need. So the way that they do that is they contact everybody. They're supposed to be contacting everybody at least once a year to update their file and conduct a level of need assessment so that they can identify those individuals that meet that most in need criteria. And then they make a recommendation to their supervisor as to, okay, these folks are most in need. They really need a waiver. Let's move forward with that process. It's really important that you're maximizing all available resources. That's part of that determination of who is most in need. So if you're applying for the waiver and you are in that conversation with the planning list navigator, the planning list navigator is going to ask, so are you using family support? And if you say, what's family support? Then punt, they have pushed you back to a family support services provider because you're not maximizing all resources. So it's going to be very important for you to go, yep, I'm receiving family support services. Yep, I'm receiving voc rehab services or any services that the individual is receiving in school. And this is why you see most awards are after the person has aged out, because when they're in school, the planning list navigator is like, hey, they're in school, they're getting a bunch of resources through the Department of Education, they're okay right now. But then it's important for you to go, okay, what's going to happen when they're not in school? So I really want people to start stepping up that advocacy process when their loved one's 21 because they age out at 22, and we want to push for a seamless transition of services so we have some continuity of care. This is a list of some of the planning list considerations. So if you're the planning list navigator and you're talking to an individual's family of like trying to make that determination of who's most in need, and we've all heard those myths of somebody has to die before they're going to get a waiver. Where is that coming from? It's coming from the fact that the number one planning list consideration is death or incapacitation of a parent or care provider. What that means is that I can have somebody who's been on the planning list for 15 years, and then I can have somebody who's applying today who's going to be viewed as most in need because their parent has passed away and they don't have anybody there to help provide support to them. So they're in that crisis situation. So they are closer to that most in need designation. So death is always number one. Is the individual engaging in any behavior whereby there is a risk of harm or injury to themselves or others? That's going to be a big flag. One of the goals of the Now Comp Waiver program is to promote stabilization in families and to reduce the number of individuals who are going into another institutional setting. So institutional settings like nursing home care, institutional settings like mental hospitals, institutional settings like jails, incarceration. So we want folks to have services in their home. So if there's anything that's going to put them at risk for services in a institutional setting, we want to try to prevent them from going into an institutional setting by providing appropriate services in that home and community-based setting. Serious medical condition of the care provider that compromises the ability to provide care to that person. So when you're doing advocacy, you're doing it on a twofold level. You're talking about what the individual needs and you're stressing all of their needs, right? Like this individual requires full supports for this or partial supports for this, or is highly vulnerable, so at risk for exploitation. They need to have companion assistance in the home. They need to have companion assistance in the community. We want to document this, right? But we also want to document what else is going on in the family. So if I have, and I've had this situation before, where mom gets a diagnosis of breast cancer. Holy smokes. Okay. So we're dealing with that. We're dealing with this. It's a lot, right? So being able to feel comfortable disclosing some of these things to the DBHDD is going to be really important. I know we're all private people and we want to kind of keep ourselves to ourselves, but when we're seeking support, sometimes the better strategy is to have complete candor. And that means, okay, this is what I'm going through, and this is negatively impacting my ability to take care of my child. Or we're seeing an increase of behaviors. We were fine until we had 18, and now we've got some comorbidity with anxiety and depression that looks like anger and irritability. So we're seeing a lot more behaviors and we're seeing some physical aggression and we're struggling. So this is the kind of stuff that we want to document so that we can ensure that we're able to provide the appropriate level of care. Um, if you're not able to work, because the individual can't be left at home. That's part of the criteria. So you just want to be able to be familiar with what the state is looking at in terms of what constitutes what's most in need, so that you can present your case consistent with those considerations. So yeah, if it's very common, I hear all the time, I've been on the planning list for many, many years. But if the individual is still in school and they haven't aged out of the school system, they're traditionally going to be looked at as less most in need in comparison to that individual who has aged out. So that's why anytime that you're experiencing a significant change, whether it's a change in behavior or change in a type of setting because the individual is now aged out of the school system, you want to make sure that you are sharing this information with your planning list navigator. How do you know what your status is with the planning list? If you don't know your planning list navigator, you can assume that they don't know you. So I would make sure that you are in regular contact with your planning list navigator so you can help share what's going on and that you can provide documentation of what's happening to demonstrate this most in need criteria. So you get that phone call that says you've been awarded. Yay! So here's what happens then. At that point, your case is moving from the planning list navigator to a planning list administrator. So that planning list administrator is focused on making sure that you have all the paperwork in place, and then you begin that process of assessments to kind of hone down what are those critical needs that this individual has. So again, what they're going to do first is they're going to have you complete that DMA-6. They're going to select a fiscal agent. So everybody has to have a fiscal agent. And even if you are selecting all agency providers, you still have to have a fiscal agent. The fiscal agent, Acumen, Continuum, these are organizations that are basically managing the budget. And so, like when you're awarded, you never have access to the funds. You work through your fiscal agent. If you're self-directing means that you want to hire the individuals to provide care for your loved one. So let's use my son as an example. So y'all know I got a guy, Eric. He's 30. He receives a comp waiver. I self-direct his care. Why? Because he does better with male care providers. Okay, so I want to be able to recruit and hire and train the staff. So I'm bearing that burden, another hat to wear. Yay, human resources professional, recruiting, hiring, and training. But this way, I'm able to make sure that we have a good match, right? And so then that also means I have to document everything, and I have to submit timesheets to my fiscal agent, and then I have to coordinate with the support coordinator that I have through the support coordinating agency, who comes out once a quarter, and we discuss what the needs are, and we discuss the documentation that we've provided for all those services. So it's a lot to self-direct, but it's a great way to be able to manage that process to your specifications. So you're always going to have a fiscal agent. You're always going to have a support coordinating agency. So that support coordinating agency, that's such a good feeling, y'all, because when you go through the IEP process at school, doesn't it feel a little bit like a battle, like sort of this us versus them dynamic? When you have a support coordinator, you feel like you have an ally. So you have somebody who is there to talk about services and to help make sure that services are going well. So you're going to identify those groups. Then you're going to go through this process of completing assessments. And again, this is a process designed to highlight what those needs are, so then they can correlate appropriate services to those needs. So the big one is a supports intensity scale. This usually takes about an hour and a half with someone who's trained to administer this. This is a deep dive on the frequency and level of supports that are needed across all these different areas. You'll have a nurse conduct a health risk screening tool so we can identify any health risks that are out there. We'll also have a behavioral assessment to determine if behavioral supports are required. So you go through all these assessments. If you want to self-direct, you also have to do self-directed training. And you're identifying who your providers are. And once you've identified those providers and you have a clear sense of what those services are, that's when you develop an individual support plan. And that's when services really begin. So this process from planning list administrator through the assessments and development of an individual support plan, this process takes anywhere between 8 to 10 months. So then you have service delivery. So you got the ISP in place, the prior authorization, that's the budget. Now at that point, you are able to pass the baton from planning list administrator to the support coordinator, and those services should begin. Yay. Again, data has to be collected based on the ISP goal. So everybody's going to have at least one goal that is attached to each service that is on the ISP. So the ISP, let's say the ISP has community access group and you have a day program provider. That day program is going to be part of that ISP process, and they're going to identify at least one goal for that individual to have as they participate in that program for that year. Support coordinators typically check in once a quarter. There's an intensive level with waivers as well, and they typically check in on a monthly basis. So what happens when you experience a change? Life happens. So you experience that change, you request an ISP. VC stands for version change. So that's basically saying, okay, wow, we never had behavioral issues before, and now we do. So now we need some behavioral supports. So the support coordinator would have to do an assessment. So they're going to have the behavioral team come out, and they're going to go, yep, we really need a behavioral plan. Then they write an ISP version change to add that support to the current ISP. So an ISP runs birthday to birthday. So it's not on a fiscal year basis in that regard. It's driven based on that individual's birthday. Quick question from the chat group. Can you have both Medicaid waivers and family support services at the same time? You can't have a now comp waiver at the same time as family support. However, if you've been awarded a now comp waiver, remember how I told you it takes about 8 to 10 months to get to that PA, that budget, the ISP. During that time, you can receive family support services. At the point in which there is an ISP and a budget, at that point, it's only now comp. You cannot have family support services at that time. Would the Medicaid waiver deny your application if you've already applied for family support? No. So again, when we're talking about strictly now comp waiver, comp is at the top of the ladder, largest, most robust program. The average comp waiver is probably $60,000-$70,000 worth of services annually. It's a big program. Now is in the middle of that ladder. The average now waiver is around $30,000. So the typical now waiver is going to look like a day program plus a little bit of CLS. The typical comp waiver is going to have a substantial amount of community living support or community residential alternative, as well as community access group for a day program or community access individual for that person to go into the community. So, but the average now waiver is about 30,000. And as you're aware, the family support services also in the same family, not viewed as a waiver because it's paid only through state funding at a much lower level of funding. How do you reconnect with the planning list navigator? Is there a phone number? Depending on what region you're in, you're going to have different planning list navigators. So what you would want to look at is what is your regional phone number to connect to that planning list navigator. How do you follow up with the application for NowComp? It's the same way. You're going to have to contact that regional office to make sure that your application has been completed. I'm really concerned for individuals who've applied for a waiver and then they never hear back. So don't assume that you're on the planning list. If you have not ever been contacted by a planning list navigator to do an assessment, likely you're not on the planning list. Okay, I'm looking through some of these questions. Yeah, if you don't have Medicaid, you can't have a Medicaid waiver. So when we're talking about programs like Now Comp, we're talking about, one of the questions like, where's the funding source for this? And so it's a blend. It's a blend of federal dollars through Medicaid as well as state dollars. So you can be on the planning list and not have Medicaid, but you can't ever be awarded a waiver without Medicaid. So if you're in a situation where you've lost your Medicaid, we need to look at that to make sure that you regain or get reinstated back to Medicaid eligibility so that you can continue your eligibility on the now comp planning list. Can you have gap and a now waiver at the same time? No. If you have a now waiver, you can't have any other waiver program. If you have gap, you can have gap with family support services. You can have independent care waiver and family support services, but you can't have any program like gap or independent care waiver or CCSP or source and a now or comp waiver. Any other questions? Let me try to scroll through here, see if I missed anything. Yeah, should you complete a now comp application if you have Katie Beckett? Yes. So Katie Beckett, while it's a waiver program, it's a deeming waiver. All Katie Beckett is access to Medicaid. It's not access to services. So Katie Beckett, you want to have that for access to Medicaid, but you want to be on the now comp planning list so you have access to services and you want to be utilizing family support services in the meantime. I just want to jump up and down for a minute to just reinforce the need to be on family support services while you're on the now comp planning list. It's going to be very difficult for you to show that you're most in need of services. Put yourself in the shoe of the planning list navigator. Why should I say that you're most in need for a waiver if you've not utilized the lowest level of services in this same family, right? Kind of makes sense. So make sure that you're on that planning list. If you are enrolled in an intensive family support services, it's a mandate. And keep in mind, there are going to be individuals who are eligible for traditional family support services who may not be eligible for a now comp waiver. If you have autism without accompanying intellectual impairment and an adaptive function score that's above 70, remember you're not eligible for now comp, but you're still eligible for your traditional level of family support services. So make sure that you're maximizing your family support services while you're on the planning list. So important. Have I missed any other questions? Y'all feel free to just jump in, use the chat, raise your hand. I'm happy to answer any questions that you may have.
There are several new questions in the chat.
How important is it to have a letter in hand that says you're on the now comp planning list? I think it's pretty important. We actually use that letter as part of our documentation when we're seeking Social Security services for folks, because we're showing Social Security that, look, this individual has met the severity and impact requirements for a home and community-based waiver through the State Department of Health. Ergo, they should also meet severity requirements for Social Security Administration. So if you have that list, keep it. It's also maybe good documentation, when our kids turn 26, they lose their eligibility to be part on our private health insurance. But if we show that they're disabled, then they can stay on that private health insurance for their parents. So having that letter can also support that. When a person gets disabled adult child benefit from Social Security, does he lose Georgia Medicaid because the DAC amount is higher than SSI? Short answer to that is no. The individual should have adult disability, what you would call CDB, childhood disability beneficiary access to Medicaid. Medicaid is complicated. Y'all, I have to take classes on Medicaid every year because it is that complicated. There are over 30 forms of Medicaid in Georgia. And so the most common is SSI Medicaid. If you are approved for SSI in the state of Georgia, there's automatic enrollment in Medicaid. Yay. But what happens when the parent retires and the parent is now drawing retirement? That allows that individual to move from SSI to SSDI on the parent's work record, right? And yay, it opens the door to Medicare, but it should not close the door on Medicaid. It's, I swear my job is translating English to English. I'll get this letter from Medicaid and it says, you've been terminated. And you're like, huh? And what they're doing is they're terminating you from SSI Medicaid, and then at the bottom of the letter, "You've been approved." What? And so what they're doing, I wish they would just say, "Hey, we're just changing your classification. You're good." That would just solve everything. But this long, convoluted letter basically helping you understand that you're no longer eligible for SSI Medicaid, but you're still eligible for Medicaid as a childhood disability beneficiary. The thing is, those resource requirements are chronic. They're continuous and ongoing. You can never have more than $2,000 in resources and be Medicaid eligible. That's just a rule. And that's where you can become at risk for losing Medicaid if you go over that resource limit. So if you're over that resource limit, what do? You set up an ABLE account so you can put some of that money in the ABLE account. Any money that's in an ABLE account is not viewed as a countable resource for purposes of government benefits. So you put that money in the ABLE account. That way you're able to maintain that Medicaid eligibility, and you can continue being on that planning list, or you can continue receiving these benefits. And this is why we want folks to do life care planning, because again, let's use my son as an example. We have a supplemental needs trust set up for him. It's not fully funded, but if I get hit by a MARTA bus, it's going to be fully funded, right? Because my life insurance designates his trust as a beneficiary. So that enables the money to go from, that bequest or through that life insurance directly to the trust, not to him individually. So he's never jeopardizing his Medicaid eligibility status. Follow me? You really need to have these safeguards in place because he has a comp waiver. What if that money went straight to him? That means, yay, he has this money, but boo, he just lost Medicaid and he just lost his waiver. Not okay. So we have to have this life care planning process with a supplemental needs trust, with an ABLE account, because an ABLE account is a fantastic pass-through account for a supplemental needs trust. And that way he can always maintain his Medicaid eligibility and he can always receive his waiver.
We have a question from Nancy in the chat.
What if my son, but I'm not following the question. What if my son loses Medicaid because of work? Is that right? Again, we want to maintain Medicaid eligibility. There are income limits for Medicaid. There are resource limits for Medicaid. So you have to balance that. Yeah, so the income limits, that's going to follow the 300% of income rule. Hang on, I'm just pulling out my little calculator because I can't ever remember that number. That's $2,742 monthly. So if an individual's total countable income, and it's not countable earned income, that's just countable income, meaning that, okay, I get $1,000 from SSDI. If I get $1,000 from SSDI, I can't have more than 1,742 from my work, because if I go over this 2,742, I have passed the Medicaid income cap and I'm no longer eligible for Medicaid. And again, I've lost my waiver because I'm no longer Medicaid eligible.
Miss Nancy Venter, please feel free to unmute yourself and ask your question. I see you. Raise your hand.
All right. So my son was just denied the waiver after being told he had it in May. Um, Said it's his depression causing the issues, not his IDD and ASD. That's a common thing. So what we want to do is anytime that we're documenting like behavioral episodes and things like that, we want to attribute that to autism, not to any mental health diagnosis, because the DBHDD is um, very much about saying, this is really mental health. This really isn't IDDD, and so a waiver really isn't the most appropriate form. So we really want to be careful about our documentation of everything that's going on and attribute like emotional outbursts and destabilization and decompensation to things like autism versus depression and anxiety. Um, so that's something that we would want to look at. Other questions tied to a now comp waiver? I think we're right at close to the end of our time. Um, I really appreciate this opportunity to share information. I've seen a couple of comments like, I haven't heard this information before, which is why this information is so important and why BDI wants to be a good resource to you for this information. So if you're not on the now comp planning list, let's make that a top priority. We have my email address out there. It's one email that I can send to you that has the application with that privacy practice form, because that form's kind of hard to find. And then if you have any questions about that, we can certainly help. So thank you so much for your time. I really appreciate it. We do have another session coming up in the next couple of weeks for life care planning. If you're in a situation where you're thinking about, where you need a now comp waiver over the course of the individual's life, we really need to talk about other life care planning issues. So please make sure that you register for that session as well. Thank you. I appreciate your time.
Thanks, Anna, and thanks everyone for joining us. And on your screens, you can see our upcoming sessions. The next one is on September 28th, Understanding Your Psychological Evaluations. Thanks again for joining us. And if you have any questions, feel free to reach out to Anna at anna.maki at bobbydot.org. And you can follow us on social media for our latest updates. Thank you.
Thank you. Y'all take care.